Hello and welcome to our weekly health segment, and specifically today we are going to talk about dysmenorrhea or extreme pain during menstruation. We are going to explore about the causes, symptoms and treatment of this condition by providing you with information that is really needed on how to manage this condition. Today we are joined by Dr. Fred Muhairwe. He's a gynecologist and obstetrician here at Rwanda Military Hospital. He's going to share with us valuable insights on this important topic. So before we start our interview today and explore more about the causes and symptoms and how to treat this condition, we would like to know, what is dysmenorrhea? Is it even a disease or is it a normal condition?
Normally, dysmenorrhea, it's actually a clumpy, lower abdominal pains that occurs during menstruation. Under normal circumstances, during menstruation, there may be some inflammatory process that is going on with menstruation. It somehow causes not really a big pain, severe pain. That one we may call it a normal condition in menstruation, in the menstrual cycles. It may be a disease condition if there is an underlying pathology. That is, it could be a disease secondary to an underlying condition, a disease condition, like you've had women having endometriosis, having adenomyosis, all those having pelvic inflammatory disease. Those are the ones that may worsen menstrual cycles, and they cause severe, long-lasting pains, and it becomes a disease condition.
So going ahead, what are the causes of dysmenorrhea, and what are some of the risk factors that can increase women's likelihood of experiencing painful periods?
The causes, of course, the underlying pathology, secondary to that, secondary dysmenorrhea. We mentioned of the endometriosis, which is that ectopic implants to the different pelvic regions that cause a lot of inflammation, and you have those endometrial implants actually going outside the endometrium and go to the different pelvic regions, and they cause pelvic inflammation, which actually worsens during menstrual period. Actually, the risk factors are the ones that actually increase the likelihood of that pain. So we have actually, they say having body mass index, the RMNAC, if you go into periods as early as possible. They say at the age of 11, 12 years, they go into RMNAC. And even lifestyle behaviors. Let's say if the adolescents who smoke, who take alcohols, those drug use, all those increase the inflammation.
Doctor, we would like to know the symptoms of dysmenorrhea and how can a woman differentiate it with normal menstrual cramps.
Symptoms, it's the severe pain. It's a severe pain. Actually, if you have severe pain, they go as far as getting headache, the pain that radiates the thighs, the pain that radiates the back, the pain that radiates to the chest, anywhere. So that pain may cause even nausea, vomiting, and actually others become dehydrated.
Exploring more, what are the most effective treatments to help this person who has unbearable pain of dysmenorrhea, and how can someone at home having that kind of pain manage?
If it is a primary dysmenorrhea, we normally give them non-steroidal anti-inflammatory drugs, the ibuprofen, the paracetamol, and they respond well to to those drugs. Actually, those are the analgesics I was telling you. And with secondary dysmenorrhea, we tend to, because the non-steroidal anti-inflammatory drugs, they tend to fail with secondary dysmenorrhea. Then we go further to treat with hormonal therapies. We go further to treat with GnRH agonists, other drugs, and we also tend to go for further investigations and find out the underlying pathology. Identify if it's endometriosis, we treat endometriosis. If it is adenomyosis, we treat adenomyosis. If it is, let's say, a congenital defect that is preventing the menstrual flow, we treat that congenital defect.
Thank you very much for following this interview about dysmenorrhea. We hope that what we provided for you is very informative and beneficial. And if you have long, painful periods, please consult a doctor for your own well-being. Thank you very much for following.